Hey everyone, it's the Injury Bloke here, bringing you simple and effective solutions to your injuries, your niggles, your nags, your aches and your pains. Today I thought we'd have a little look at golfer's elbow. The flash name is medial epicondylitis, so let's give you some simple stuff you can do to manage this issue. Here we go guys, hope you enjoy. So, as always, it is better to go and get an assessment, get a true diagnosis of what your problem actually is. Not rely just on me or on Google for your information, because you could well just be treating the wrong thing and getting nowhere and prolonging stuff, and then you have stuff going on for much longer than what you should have. So get your assessment first. But if you've had your assessment and you've had some treatment, and you're looking for more ways to help you manage this problem, because it can be a pain, let's see what we can do for you. Right then, golfer's elbow is pain anywhere along the inside of your forearm. Predominantly, I see it more towards the elbow joint. The bone itself can be tender. The tendons are definitely tender. And the muscles can be irritated and hypersensitive as well. It is an overuse injury, and that's going to be different for everybody because we all have different strengths, and therefore your tendons and your muscle can take whatever your tendons and your muscle can take. So if you work with your hands a lot, so I see this a lot with scaffolders, for example, being on the spanner, people that have to use screwdrivers, because the constant using and the twisting puts a lot of pressure here, and then with golf it's the thin handle, and during the swing one of the very last things that happens with the swing is this action, and hopefully you can see that as this comes in, all these muscles are working in here. So if you play golf and you've got this going on, if you work with your hands for a living, you've got this going on, you can see all these muscles are getting constantly worked, and it's therefore really easily in that respect to get an overuse injury of this kind. There's lots and lots of different treatment methods you can get for this problem, and same with everything, not one thing always suits everyone, but for me, I get a lot of success with remedial techniques, hands-on soft tissue techniques, and then I'll go through a series of rehab exercises with my clients for long-term relief. But here we're just talking about managing the pain, or being able to get on with your day and minimise the discomfort and potentially not irritate it anymore, if that makes sense. So the first thing you can be doing, a great way to reduce the pain, is just to pop an ice pack on the area. If you're at work, this might be difficult through the day, but when you get home of an evening, finished your day, definitely as often as you can, 5 to 10 minute spells, and that will decrease the pain massively for you without you having to pop pills. The next thing that we're going to do is something that you can do all day long. There's a few different methods, and again, not one size fits all, but you can try these and see what works best for you. I'll go through the ones that I find work best for my clients. So the one I find the most effective for pain management through the day, but is also possibly the one that people can't do as well, is because it's pretty unsightly. And that is simply a boxing wrap. And you'll get these from any sports shop probably for a couple of quid, probably a fiver at the most for a pair. And if you shop online, probably get free postage. You're looking to apply pressure. If you apply pressure to the muscles along the forearm, it will help to reduce the swelling that can potentially build. But the other thing is when you apply pressure, particularly to the tendon area, it will reduce the strength of the muscle. So if you can reduce the strength of the muscle and the exertion, the tug that it's putting on that tendon, it's kind of giving it a rest to some degree. So you just take your boxing wrap, and this takes a little bit of practice, a little bit of experimenting, and you wind that on and wind that on, and you get a nice bit of pressure on the forearm. I'm not going to keep going, but hopefully you get the idea with that. And then if it's a little bit too tight, you can loosen it. If it's not tight enough, you can tighten it. And they're nice and adjustable, and they're nice and cheap. So if you can wear a jumper, if you're working outdoors, this hides easily enough. If you're in an office having to wear and look respectable, this probably ain't going to be the one for you. But I find this works really, really well, and it's cheap, bargain. Next thing you can try is just a good old tubey grip or compression bandage or compression sleeve, and that goes on like so. I don't find these as good because they don't quite exert enough tension onto the area, but for some people they can help, but I don't find those as good as the boxing wraps. But again, it's worth a try. It's cheap again. The one I find the least effective and also cost the most are your golfer's elbow straps, and these come in various forms. Some are elasticated with some foam that puts pressure. This is just a strap, and then you strap that on, and then you can tighten that up as suits and try and get some pressure onto the most tender points. Again, they do help some people, but I actually find these the least effective and the least comfortable as well. But again, it might work for you. The other thing you can do, this one's a bit more fiddly and you need a therapist to do it for you. Somebody who's trained in taping. Actually use zinc oxide tape. This is a tough, inelastic tape. It doesn't stretch. I can use a taping method that stops you being able to exert excess pressure onto these muscles. It stops certain actions in order to decrease the pain by giving those muscles a bit of a rest. Can be a bit restrictive. If it doesn't get in the way of your day, it's useful. Again, it can be a bit unsightly though, because it's quite a lot of taping. And then if you want some real attention, what I find once the issues becoming minimal, when people get down to kind of just a little bit of discomfort, and they really are on the mend and they're into the rehabilitation, the kinesio tape I find is useful. It's a soft tissue support. It's elasticated. It doesn't get in the way. You can make it look nice and pretty, so you'll get lots of attention when you got it on. But this I find works later on down the rehabilitation ladder, down the rehabilitation route. Early on, especially if somebody's got excuse me, golfer's elbow quite severe, don't find this touches it at that stage. But again, you can try. You can buy this stuff off the net yourself. There's plenty of videos that give you a guide on how to apply it. It just takes a bit of practice, so you can do a little bit of self-help with that as well to keep you going. So once you've been using all those different methods to help you manage the pain and get through your day, the main thing to remember is that this is an overuse injury that's brought on by whatever it is you're doing that's finding out your weakness. It's a weakness. The muscle and the tendon can't cope with your daily activity. So identifying that is important. And then once you can get into the rehabilitation, you then address those weaknesses. All you do is wait for the pain to go away and then get back to doing whatever you was doing that caused it in the first place, it comes back easier. Once you've set the scene for an injury, Your biggest risk to things happening is if you've had it before, because you have now set the scene for it to happen again. So you need to get it assessed, treated properly, and rehabilitated properly and structured to get you back in a better position than what you were prior to this kicking off. So everything I've given you today will help you manage the pain, but that's all, okay? So again, thanks for watching. I hope you found it useful. If there's anything you'd like me to cover in these videos, just pop it in the comments down there. I will read them and I'll address those videos as soon as I possibly can. Please leave a like if you liked it. If you don't like it, useful if you tell me why, that'd be good as well. And if you want to get a notification of when I put my latest video on, I'm aiming for every Monday anyway. I'm considering Sunday, but I think I'm going to go with a Monday at the moment. And if you click the subscribe, whichever side it is, you'll get notified of that. So thanks for watching, guys. Take care.